Okay, let's unpack this. Today, we're doing a deep dive, and it's focused on just one piece of reporting,
Mm,
a CBS News article that's really raising some flags about potential, well, big changes to federal health spending and
yeah,
what that could mean, particularly, it seems, for rural hospitals.
exactly. Yeah, this whole dive is based on that single CBS News article.
Mm-hmm.
It's by Alexander Tin, updated very recently, June 12th, 2025.
Okay.
And it really zeroes in on these specific warnings coming from Senate Democrats about a proposed budget package and, the potential fallout.
Got it. So our mission here is pretty clear then. We want to walk through this article, sort of pull out the key facts, the main warnings,
Yeah.
and really help you, the listener, get a handle on the core story it's telling.
Mhm.
We'll look at the potential scale of these federal spending changes, especially Medicaid,
Right. Medicaid's central here.
and what Senate Democrats, using specific data they apparently commissioned, are saying the consequences could be.
Yeah, for those rural healthcare systems and, the communities that really depend on them.
Okay, so where does the article start? What's the context?
Well, it sets the scene, talk about a budget package. It recently passed the House.
Ah, the one President Trump called the big, beautiful bill. I remember hearing that.
That's the one mentioned.
Yeah.
And now, according to this CBS report, it's landed in the Senate. Senators are, grappling with it right now.
And the changes being discussed, they sound pretty significant.
Oh, yeah. The article brings in budget analysts
Okay.
who project that changes in that House bill, specifically to Medicaid provisions. Well, they could lead to a huge reduction in federal spending on Medicaid.
How huge are we talking?
The figure cited is, well, it's over $800 billion
Wow. Over 10 years.
over the next decade, yeah. And the article does note, for context, that the backers of these changes argue they're targeting excesses and abuses in the program. That's their framing.
Okay. $800 billion plus, that's the potential financial side. But what about the human side? What do these analysts say about, like, health coverage?
That's the other big number in the report.
Yeah.
According to the article, the same analysts project these changes could mean
Yeah.
7.8 million more people becoming uninsured.
7.8 million?
Nearly 8 million people potentially losing their health coverage. It's a stark number.
And that number, I'm guessing, is directly linked to the main warning from the Senate Democrats.
Exactly. They're sounding the alarm,
Yeah.
basically saying that level of coverage loss could, well, the word they used, quoted in the article, is devastate.
Devastate.
Devastate hundreds of rural hospitals. And they're not just saying it generally. The article reports they cited a specific list they commissioned.
A list of hospitals.
Yeah, telling 338 rural hospitals they believe are specifically at risk.
And the article mentioned something about which states.
It does. It notes they particularly flagged risks in states, represented by Republican senators, and states that voted for President Trump. So there's a political dimension pointed out there.
Okay, that leads to the obvious question. Why rural hospitals? What makes them, according to the sources in this CBS piece, so uniquely vulnerable here?
Well, the article gives a few reasons. It actually quotes the American Hospital Association.
Okay, the AHA.
Yeah, the AHA warning that these kinds of Medicaid cuts could have a devastating impact on rural hospitals. That's their quote.
And the specific reasons for that vulnerability, what did the article say?
It explains that, well, rural hospitals often just have a higher percentage of patients who don't have insurance or who rely on Medicaid.
Right, the program for lower income folks.
Exactly. And maybe even more critically, the article stresses that these hospitals are frequently the only healthcare provider for miles around. They're the sole source of care.
So if they struggle.
There's often no other nearby option for the community. That's the concern.
Now, about that specific list you mentioned, the 338 hospitals, where did the Democrats get that data? Who compiled it?
The article is specific on this. It says the list was put together at the Democrats' request by a research center at the University of North Carolina.
UNC.
Yeah, the Cecil G. Sheps Center for Health Services Research at UNC.
Okay, and how did the UNC Center identify these hospitals? What was their method, according to the article?
So the report says the center looked at data from CMS, that's the Centers for Medicare and Medicaid Services.
It's a federal agency.
Right. They analyzed that data to pinpoint which rural hospitals were facing the highest risk of financial distress.
And they broke it down.
Yeah, by state and even by congressional district, according to the article. Things they'd look for typically are factors like, how many uninsured or Medicaid patients they see,
Right.
or if they have what's called negative total margins,
Yeah.
basically losing money, spending more than they brought in.
Okay, so the Democrats get this data from UNC. What's the core argument they then make in their letter based on these findings? How do they connect the dots?
Their letter, as the CBS article describes it, draws a direct line from potential insurance losses to hospital finances.
Makes sense.
They argue that, look, if millions lose coverage because of these cuts, rural hospitals are still legally required to provide emergency care.
Emmentail, right.
Exactly. But they won't get paid for a lot of that care. And the Democrats warn this would just pile on more financial pressure, leading to, quote, deeper financial strain on these already vulnerable hospitals.
Did the article include anything from the UNC researchers themselves, the ones who actually made the list?
It did, yeah. It includes a response from the researchers, Mark Holmes, George Pink, and Tyler Malone.
And what was their take?
They stated, and this is a quote from the article, substantial cuts to Medicaid or Medicare payments could increase the number of unprofitable rural hospitals and elevate their risk of financial distress. So they're confirming that link.
Okay, so if a hospital does hit that increased financial distress, what happens next? What are the potential consequences for the hospital and, more broadly, the community, according to those researchers cited in the piece?
Well, the researchers pointed out that hospitals under that kind of pressure might be forced into some really tough choices.
Like what?
The article says this could mean having to reduce service lines.
Meaning cutting back on certain types of care?
Yeah, exactly. Like maybe closing the maternity ward or stopping chemotherapy services or even potentially scaling back emergency care.
Wow.
Or, the article adds, they might have to convert to a different type of healthcare facility or close altogether.
Close entirely. That's the ultimate fear expressed.
Does the article give specific state examples from the Democrats' letter? You mentioned Louisiana earlier.
It does focus on Louisiana quite a bit. The Democrats apparently wrote that 32 rural hospitals there, that's a majority in the state, serve a high number of Medicaid patients.
32. And the letter flagged a total of 33 hospitals in Louisiana as being at risk, based on either that high Medicaid share or having negative margins or, both.
And the article connects this to Senator Cassidy.
Yeah, the CBS piece points out the political context there, noting Louisiana is Senator Bill Cassidy's home state, and he's the top Republican on the Senate Health Panel. So it highlights that connection.
Were other states mentioned?
Yes. The article says the Democrats' letter also specifically listed Alaska, Kentucky, West Virginia, Alabama, and Tennessee as having these identified at-risk rural hospitals.
Okay. Now, the CBS article also sort of frames this whole warning politically, right?
Yeah.
How does it describe what the Democrats are doing with this letter to President Trump and GOP leaders without, taking a side itself?
It frames the Democrats' actions, the warning, the letter, as basically an effort to, quote, inform communities exactly what they stand to lose.
Inform communities.
Right. What they stand to lose if Republicans pass budget cuts that the Democrats say would, quote, effectively repeal the Affordable Care Act.
Ah, so connecting it to the ACA.
Yes. The reporting presents that as the Democrats' stated view and their strategy, linking these potential cuts and coverage impacts back to undermining the ACA. It's careful to attribute that framing to the Democrats.
Okay, so if we kind of zoom out from all the details we've pulled from this CBS News article, what's the fundamental tension here, the main takeaway the reporting presents?
I think the core tension laid out in the article is this huge potential scale of the proposed budget changes. The $800 billion plus Medicaid cut projection, the nearly 8 million more uninsured projection.
Right.
Contrasted directly against the potential impact of that on what the sources describe as vital rural healthcare infrastructure.
The hospitals themselves and access to care.
Exactly. An impact highlighted by the Senate Democrats, yes, but also by groups like the American Hospital Association and backed by the analysis from the UNC researchers that the Democrats commissioned and cited. It's that clash between the proposed policy scale and the potential real-world consequences for rural health.
So, this deep dive today, focusing entirely on this one CBS News article, has really centered on that specific warning from Senate Democrats about potentially significant Medicaid cuts in this budget bill and the risk they're highlighting using that commission data to hundreds of rural hospitals nationwide.
Yeah, we've tried to unpack the numbers involved, the reasons why rural hospitals are seen as particularly vulnerable according to the sources cited.
Right, the methodology behind
the data was compiled, and the potential downstream effects for the hospitals and for the communities they serve. as described by those UNC researchers quoted in the piece.
Okay, so let's leave you, our listener, with something to chew on, stemming directly from this reporting. Given that the article really emphasizes how rural hospitals are often the only source of care in their communities.
Yeah, that point came up repeatedly.
What are the broader ripple effects? Thinking beyond just the hospital building itself, what are the implications for basic access to healthcare and maybe even the overall well-being and economic health of these rural communities if those hospitals do face the kind of increased financial distress or even closure that the UNC researchers suggested is possible in the CBS News report?
It definitely widens the lens, doesn't it? From hospital finances to community survival almost.
Something to think about.